Welcome and thank you for attending this training on developing an effective marketing plan, sponsored by the Center for Chronic Disease Prevention and Control at the Maryland Department of Health. My name is Sue Vaith, and the Diabetes Coordinator at the Center, and I'm very pleased we're able to bring this training opportunity and others to all Maryland providers of evidence-based programs. Today's webinar is being recorded. Please use the Q&A function to submit questions. There will be an opportunity to address questions at the end of the webinar. All participants will be directed to an evaluation upon completion of the webinar, and certificates of completion are available. So please complete the evaluation in order to receive a certificate. This is a slide that shows the mission and vision of the Prevention and Health Promotion Administration, where our center sits. Next slide, please. So I want to take a moment to let you know some of the resources that we have available in our center to help you manage and sustain your programs before we move on with a marketing webinar. So aside from this and other past and upcoming trainings such as motivational interviewing, providing compelling group sessions, and marketing, we provide sister websites, the BeHealthyMaryland.org and the Workshop Wizard. The Workshop Wizard is a HIPAA-compliant site that helps you publicize classes, manage referrals and feedback to physicians, manage data, and assist in billing for the diabetes prevention program. Our center also provides periodic funding opportunities for evidence-based program providers to expand their programs, or to other community-based organizations to develop new evidence-based programs. So we have Diabetes Prevention Network that meets quarterly via a webinar and in person, and are planning the same for diabetes management providers. This webinar is being recorded and will be available on our Be Healthy Maryland Partner Resources page and in the Help section of the Workshop Wizard. If you want more information about any of these resources, please contact me at sue.vaith@maryland.gov, and that is on your screen. You'll be getting a copy of these slides as well. I'll now turn it over to our speaker, Hannah Harold. Hannah is the public health consultant with expertise in chronic disease prevention and management. She provides technical assistance and training to federal, state, and local public health agencies across the U.S. Hannah?
Thank you for the introduction, Sue. I'm happy to be here today to present this webinar. Just a couple of quick acknowledgements and disclaimers before we begin. As Sue mentioned, this webinar is developed with funding from the Maryland Department of Health Center for Chronic Disease Prevention and Control. And just as a general disclaimer, any statements presented in today's presentation are solely the responsibility of myself and do not necessarily represent the views of the Maryland Department of Health. So just a quick review of today's learning objectives. Throughout the course of this webinar, we're going to review in depth the components of a marketing plan. And as a result of today's webinar, you should be able to understand the importance of having a marketing plan, as well as identify any resources that are available to assist you in the development of your own marketing plan. So to begin, let's just go over the 7 components of a marketing plan. Now, if you were to get on Google and search for components of a marketing plan, some places say there's 5, some say 10, some say 9. It really is different depending on the industry. These 7 components here are a good summary of the components that would be needed in a public health marketing plan for an evidence-based program. So those 7 components are a situational analysis, which is really an examination of what is the present condition of your program. So for your specific program, what are its strengths and weaknesses? What's the current state of the program? The next step is the target audience. So who is it that you plan to market to? Next would be SMART objectives. What is it that you want to achieve with this marketing plan? Your market strategy. So now that you know who you're marketing to and what you want to achieve, how are you going to market and through what sales channels? The budget, of course, that's always a concern with pretty much any programmatic work, is how much do you have available to spend. Your action plan, which is really the to-do list. Who is going to be doing what and at what time? And then finally, metrics, evaluation. That's always an important component of any public health work, is how are you going to track your progress and your success. Now, as we go through this webinar, it's really important to recognize that a marketing plan for healthcare or public health or behavior change is a unique process. Behavior change is complex. It takes more than just a good marketing message. If behavior change were controlled entirely by the messages we hear, there would be no smokers, everyone would get all their servings of fruits and vegetables, we'd all be perfectly healthy. But it's more complex than that. So just something to keep in mind as we're going through these components, that behavior change is complex and you'll have to recognize that as you're working on your marketing plan. So we're going to start with that first step of the marketing plan, which is the situational analysis. So the purpose of the situational analysis is really to understand and organize all of the information you have about your program, the current state of your program, and your program's needs. So this might include information about your program's mission, vision, and goals. Now, if you don't have written mission, vision, and goals, this might be a good time to do so. This is also where you want to recognize and inventory what resources you have. Now, these can be tangible or intangible resources. They could be funding, personnel. They could be things like specific expertise or experience that your staff have. Other resources could include your partners. So are there partners that could be a valuable resource in your marketing efforts? Perhaps a partner who has done quite a few in-depth marketing campaigns and has a little bit more marketing experience that they could be able to contribute to your marketing process. Another good resource to consider is schools or universities in your area. Schools or universities that have marketing programs oftentimes have students that are looking for projects, and involving a marketing student in your project can bring not only extra manpower or womanpower to this project, but then you get the benefit of the student bringing your marketing plan back to their professor for their school project and getting a little bit of additional eyes or expert eyes on your marketing plans. Next, I'd say, who are your competitors? Now, let's say you were a company that was manufacturing and selling widgets. Your competitors are the people that you want to beat out and sell more. In public health, it's a little different. You know, your competitors aren't people you're trying to beat. I say competitors because you want to recognize who are the other programs and providers around you. These kind of align with your resources. Who are programs that perhaps you could partner up with and share referrals with? What do the programs nearby offer? So if your program is currently offering BDSMP and you're hoping to expand and another nearby program offers DSMP, you could complement what they're offering by then providing chronic pain self-management. So it's really just a recognition of who is nearby, who can you support, and how can you work together to offer the most comprehensive evidence-based programs for the population in your area. And then lastly, what are your strengths, weaknesses, opportunities, and threats? So this is a SWOT analysis. The chart on the screen there is a good way to do it. You just fill out each of the 4 boxes. And a SWOT analysis helps you look at both the helpful and harmful factors that are from an internal origin within your program or an external origin from outside factors. So another way to look at it that's a little bit more specific to public health is the 3-step process. So first is recognizing what are your program goals. As a diabetes self-management education and support program, what is it your program wants to achieve? The next thing you'd look at is what is preventing you from meeting those goals. So after you've created this written list of goals, for each of the items on that list, each of those goals, why are they not being met? What's preventing them from being met? And then lastly is kind of the ideal situation. Okay, relative to that goal and what's preventing, excuse me, and what's preventing them from being met, what do you want to see happen? What would be ideal? You can kind of summarize this by calling them goals, gaps, and activities. So really the gaps part there is what's happening now, what the current status is, and the activities is the future and what you want to see happen. And so your activities should be answering the questions, okay, now what? What's our next steps? What behaviors need to change? What do systems or organizations need to change? How do we address these gaps? So let's do an example. Let's say you are the coordinator for a diabetes prevention program, and your goal is to enroll a minimum of 10 DPP eligible adults into your class That way you have an adequate cohort size to meet CDC requirements for recognition. 10 is more than the minimum required, but you want a little bit of a buffer so that if there is participant dropout, you still have that required number. When you're evaluating what the gaps are, your experience in the research you do shows that the reason people aren't enrolling is because they don't know that they're at risk for diabetes. So that's the gap. And then when you're looking at the activity, which is what do you want to see happen, you want to see increased awareness of prediabetes among those populations who are eligible. So that's your goal, your gap, and your activity. Now, I mentioned this already, but I just want to come back to it and reflect on that behavior change is complex. As you're developing this list of goals, gaps, and activities, sometimes the gaps that you've identified really can't be solved by an immediate communication or marketing campaign through your program. Sometimes the gaps are a little bit bigger than that. So there's other things that could be influencing your gap beyond just a marketing campaign that could fix it. Sometimes it's health education of the population you're working with. Sometimes it's public policy. Sometimes it can be cultural or outside factors, outside factors related to friends and family. There's a whole lot that can be influencing these gaps. And it's important as you're coming up with this list of your goals and your gaps to recognize which gaps can my program adequately address at this time with the resources we have available. So let's think back to our example of wanting to enroll a minimum of 10 DPP eligible adults into your class. And the gap we came up with was that they aren't enrolling because they don't know they're at risk for diabetes. So what kind of gap is that? That's going to be a communication or a marketing gap, or it can be addressed by communication or marketing. You can provide health education communication, health education marketing to help people realize that they are at risk for diabetes or that maybe they do have prediabetes. Now, let's say you were doing this analysis and instead the gap you came up with was the DPP isn't covered by most health insurance providers, and so the program is too expensive. Now, that gap is more of a policy gap. Now, while a marketing campaign can target policy issues by advocating for policy change, that might not be the appropriate marketing plan for your program at this time. So it's really important as you come up with this list of goals and gaps to recognize which gaps are appropriate to address by your program at this time and which may need to be addressed by another organization or at a time in the future. So this whole process that you're going through can be called your formative research. This is what you're doing to help then develop broad marketing plan objectives. So we've come up with our goals, our gaps, and our activities, which is what we want to see happen, and we're going to use that to write our objectives. So your broad objectives should link those goals and gaps together. So using that example that we've been working on, a good example of a broad objective would be to improve DPP enrollment by increasing awareness of prediabetes among priority populations. That addresses our goal and our gap and links it together. Now, I know a lot of you have probably been trained in SMART objectives and you're thinking, well, that's not a SMART objective, which is true. At this point in the planning process, we haven't started on our SMART objectives. We're just coming up with broad overarching objectives that link those goals and gaps together. So that's our formative research process, or the situational analysis phase of a marketing plan. Next, we're going to move into the target audience. So now that we know what our objectives are, we've come up with one or two broad objectives, we need to brainstorm potential audiences. So keeping in mind those objectives, who would be a good target for your efforts? Who do you already have a relationship with? Which audience might be higher priority? Or is there an audience that absolutely must act in order to make a difference in the gaps you identified? And if so, why would they make a difference? So thinking back to our objective of improving DPP enrollment by increasing awareness of prediabetes among priority populations, there's a variety of audiences that you could target. You could target the priority population directly with a health education or health communication campaign that increases awareness of prediabetes among that specific population. Or you could work with providers, pharmacists, healthcare professionals that may be interacting with that population. Providers and pharmacists are also people who can help increase awareness of prediabetes among that group. So there are multiple audiences that you can pick for each of your objectives, and that's okay. Most marketing campaigns do target more than one group of people. So once you've brainstormed and identified those target audiences, whether it's one group or multiple, it's really important that you understand in depth your target audience. So on the most basic level, that's going to include their demographics: age, sex, race, ethnicity, nationality, income level, where they live, sometimes education level. There's all sorts of demographics that could be important to that population. But to develop an effective marketing campaign, it needs to go beyond demographics. In addition to demographics, you need to understand their attitudes, their awareness, their knowledge, their beliefs, and their perceptions. So what do they think and or feel about your program? If you're a diabetes prevention program, what is their knowledge of your program? What's their attitude towards your program? How do they perceive your program? And then what about their health condition? So prediabetes, what is their belief, awareness, knowledge, et cetera, about prediabetes? If they're from a particular culture, how does their culture influence this? And what other factors might influence it? Also look at their social network. Who is it that they trust? Who is part of their social network? Where do they typically get their information from? And then looking at barriers and facilitators. So what might support their behavior as it relates to your program and what might prevent it? You can think of this as habits and threats. And this part of the audience process is your target audience process. It's really important to involve partners. So back in stage 1 of your marketing plan, you identified partners that could be resources. If you have partners that are very familiar with your target audience and their community, they would be very important for this understanding your target audience portion. So it's a good time to bring them in and get their feedback on the behavioral and psychosocial components of that target audience. A couple other resources that you can use when trying to better understand your target audience might be healthcare professionals in your community who do a lot of work with that audience, any local organizations that work with them. You can also do research online, look at peer-reviewed journal articles. There might be publications or reports about your target audience. A couple good places to search for those would be PubMed or Google Scholar. There's also many journals out there that you can find information in. And if you can't find the information you're looking for that way, primary research is always an option. You can conduct a focus group where you bring in a group of people from your target audience, ask them predetermined questions, or you can do one-on-one interviews. Primary research and one-on-one interviews is a little bit more in-depth, takes usually more time and money, but it can also give you a very valuable feedback from that population itself. So finally, now that you've done all of this research on understanding your target audience, it's good to summarize it in a written document, so a target audience description. And this document is usually going to include information on who is the audience, what is their cultural understanding, what barriers do they have to participating in your program, what are some of the benefits of your program to them, what are their media habits, where do they get information, what are some community places that you might find this population at frequently, and then just a general summary. Here's an example of one of these target audience descriptions that the CDC put together. This is for Korean Americans in Orange County diagnosed with diabetes. And so this is a target audience description for a DSMES program marketing campaign. So they identified their population, looked at what some of the cultural understanding is to their population and how it might relate to diabetes. Quite a few different barriers were identified to participating in DSMES. They didn't recognize too many benefits of DSMES, which isn't a problem if that's true for your population. Understanding that, okay, this population doesn't see any benefits is an important part of developing an effective marketing plan. Then they went into their media habits, and they found that this Korean American population really tended to use newspapers and magazines. And they listed quite a few examples of these magazines and newspapers that this population got their information from. Same with websites and radio, some community places you might find this population, and the general summary. So now that you've researched your target audience and developed a target audience description for each one of the audiences you plan to target, you can move into developing SMART objectives. So these SMART objectives are going to be specific, right there, specific, measurable, achievable, relevant, and time-bound. And I think quite a few people who work in public health are familiar with these, but we're going to go through a few examples. So previously, we developed a broad objective for the example we've been working with, which is we want to improve DPP enrollment by increasing awareness of prediabetes among priority populations. Now we're going to convert that into a SMART objective. So there's a couple examples here of how you could do that. You can write it as improve DPP enrollment by 30% by the end of 2020. Or another example would be increase the number of new DPP enrollees who are aware they have prediabetes by 50% in the next year. Each of these is SMART, so it's specific to our activities, right? It's relevant to our program and our goals. It's measurable. We have a number in there, 30% and 50% that we can actually measure and track. It's achievable. We feel that we have the resources at our program to achieve these. And now achievable may be different depending on the program. This specific SMART objective may be achievable for one program, but not for another. So it's not so much the number you're thinking about, but the number as it relates to your resources. It's relevant. It is tied back to our broad goal and our activities. And it's time bound. We have a deadline in there, either 2020 for that first one or next year for the second one. And the CDC does have a SMART objective resource that's very helpful if you're wanting some extra practice writing SMART objectives. It goes through each of those 5 components: specific, measurable, achievable, realistic, time-phased or time-bound, and then gives you a little bit of a checklist to see how your final objective is written. Now, we developed a SMART objective for our general goal, but because this is a marketing campaign, we also need SMART objectives specific to our marketing efforts. So there's a few key metrics to know about when you're marketing, and these are reach, exposure, and awareness. So if you have a marketing campaign, let's say you're doing a billboard ad. Reach is the number of people who have an opportunity to see or hear your message. If you put your billboard ad on a highway, and you know that highway has 500,000 drivers who drive down it every week, your reach is 500,000. That's the total potential number of people who have an opportunity to hear or see it. Exposure is how much your audience has engaged with your message. So while there's 500,000 drivers on that highway, some of them might read it, some of them might not. And so exposure is the extent to which, or the frequency with which that billboard has been read. And then lastly is awareness. This is, does your audience know about your message or its campaign? How familiar are they with it? So here's another example using a radio station ad. Let's say you develop a radio ad that's going to play in the morning slot on your local public radio station for 1 week. And radio stations, media stations, they typically have numbers for their listeners or their viewers. So when you're doing a marketing campaign and evaluating different media outlets, they can usually tell you, oh, well, we have X number of listeners per day or per month. So this radio station specifically has 1,000 listeners. And so, you know, your reach is 1,000. That's the total number of listeners who could potentially hear your ad. Now, in that 1 week that your ad was running, it was heard 3,750 times. So some people may have heard it more, some people may have heard it less, but that's the number of times it was heard. And this is cumulative. So if Bob heard the message 10 times, that 10 gets added to that exposure. And then lastly is awareness. You know, how familiar are the listeners with your ad? Bob, who heard your message 10 times, is probably more familiar than Linda, who only listened to the radio 1 day and heard it once. So when you're thinking about writing SMART objectives for these metrics, these marketing metrics, there's a few standard numbers out there that you can aim for. In public health marketing, reaching 60% of your total audience or higher is great. So if you think back to your audience, let's say your audience is Korean Americans, like that one example, and Korean Americans read these specific magazines and you advertise in them, and you know that 60% of that Korean American population reads those magazines, that is a great reach. 30 to 50% is moderate, 20 to 30 is low, and less than 20 is very low. So that's your reach. Now, if you look at the exposure, according to research and the community guide, messages need to be repeated multiple times by multiple sources through multiple channels in order to be effective. That could mean your media campaign is presented via radio, via TV, and via billboards. So different multiple sources and channels. And a person might see the billboard on their way to work, but also hear it on the radio. So they're hearing it in different ways. According to a model that was developed to calculate the effectiveness of marketing, about 12 exposures is kind of the magic number for highest awareness. If you can get 7 exposures, 7 is the standard number. For 7 exposures is pretty good. People are starting to be aware. 12 is about the magic number for it's perfect. But if your exposure gets to be too high, if you're like, I'm just going to go for way above 12, your audience will experience something called fatigue. And that's when they get tired or sick of hearing your message or seeing your message. So I have an example of that. I'm going to get that set up here. And I'm going to turn the volume down. I'm not sure how loud this will come through your headset, but here's an example of a message that many of you will probably recognize and most likely have some fatigue from. All right, I won't make you listen to all of that, but chances are most of you recognized that message, and most of you were like, oh man, not that again. You've experienced fatigue. So we set our broad program objectives, and then we set SMART program objectives. Now that we recognize some of the metrics you can use for your marketing campaign, we're going to set SMART objectives for your reach, exposure, and awareness. So here's a few examples. One would be to reach at least 300 DPP eligible patients with prediabetes awareness messages within the next 6 months. This is SMART, right? It's measurable, it's relevant to our program activities and objectives, and it is time-bound. We said within the next 6 months. Another example would be to reach 35% of physicians who serve our target audience population with DPP messages and materials at least 7 times in 1 year. Final example would be to increase awareness of DPP among area physicians by 25% within 1 year of program implementation. Now, as you're setting these SMART objectives for message reach, exposure, and awareness, think about the measurable aspect specifically. Look at that third example for this discussion. So that third example is we want to increase awareness of DPP among area physicians. Before you set that goal, do you have a way to measure that? Really, the only way you'd be able to measure that would be either surveying all physicians or interviewing or surveying a select sample of physicians in your area and tracking their awareness of your diabetes prevention program. So if that's something that you can't measure, you don't want to set that as a SMART goal. The other ones are a little bit easier. So that first one, reach at least 300 DPP eligible patients. If you have a DPP ad on a TV station with very definite viewership numbers, and you know approximately what the percentage of DPP eligible patients there are out of those viewers, you can track that. So it's very important to keep that in mind as you're setting these SMART objectives. And if marketing is pretty new for your program, you want to focus on reach and awareness. Those are the two that are a little bit more important at that stage. If you're more experienced, then start focusing on frequency and increasing the frequency that people are hearing or seeing your messages. And lastly, as we're talking about frequency and deciding how to set those goals, this is just a checklist to help you determine how high of a goal do I need to set for reach, exposure, frequency, things like that. And the more of these items you can check off this checklist, the higher your message frequency needs to be, which means either a higher reach or higher exposure. But if you go through this list and you check off most or all, your marketing campaign is going to need a little bit more reach and a little bit more frequency in the beginning. And honestly, in public health, most of the time, the majority of these are checked off. You're working with an audience who might not be interested in a health topic, or this is completely new information for them, or it's a complex behavior that you're working to change. All of these mean your marketing campaign needs a little bit more reach and a little bit more exposure. So next we're going to move into marketing strategy. So now that we've developed our goals or our objectives, we have some SMART objectives, we know who we're targeting, we know what we'd like to achieve, we need to decide what we're going to tell them. This is where we figure out the what, the how, and the where. So the what is, what do we want to say? What is our message that we're trying to share? Is it one that we are going to create, or are we going to use a message that's already created by another organization? The how is, how do we want to say it? Through what materials? I'm sure you've all received flyers or postcards in the mail. You've seen TV ads, heard radio ads. You've had one-on-one conversations with your doctor or a family or friend. There's different ways you can share advertising materials, and that's the how. Lastly is the where. Through what channels are you going to say it? If you'd like to do a radio ad, what specific radio channels will it be on? If you're doing a print ad, where will you be putting the print ad? Now, before writing your own messages, you want to see what messages are out there. For evidence-based programs, the CDC, the American Medical Association, American Diabetes Association, the Association of Diabetes Educators, the Ad Council, the National Council on Aging, these are all organizations that have developed messages already. And not only have they developed them, but they've tested these messages to make sure that they work. Here's some examples of those. So this is a little flyer for CDSMP, a poster for diabetes or prediabetes awareness. This is a flyer for DSMES. This is from Ad Council, some videos you can choose from to promote prediabetes screening. And then this was a PowerPoint to share information about the Chronic Disease Self-Management Education suite of programs. And these are only some examples. There are dozens, if not more, out there available for you to choose from. The Maryland Department of Health also has created some promotional materials that evidence-based programs are welcome to use. These include options for TV, radio, print, and they're available for the National DPP, DSMES, as well as video and print materials for the Chronic Disease Self-Management Program. So the link there on the screen for the YouTube is where you can access some of the videos that they have available. The print ads include ads for transit and other materials, and you may have seen these. The department runs periodic public campaigns with these ads, and all of these ads point back to the BeHealthyMaryland.org website. So the BeHealthyMaryland.org website is a place where, as an evidence-based program, you can actually post your classes. And if people are on that website and are interested, they can register their interest for your classes. Lastly, the department also has some free software called the Workshop Wizard that evidence-based program providers can use to manage and publicize their classes. If you want more information on this Maryland-specific marketing material, you can contact Sue Vaith at the Department of Health. Her email address is on the screen there, or Mia Matthews, which is mia.matthews@maryland.gov. And they can give you some more information on accessing those resources. Now let's say you've examined these resources and these messages that are already available, and none of them really work for what you need, and you'd like to write your own. You want to make sure you tailor them to your specific audience and follow some of these tips to make a better message. So you want the message to be clear and easy to understand, which typically means it's shorter. Shorter messages are better. Use questions or prompts to inspire the audience to think, but don't nag them. If you can make it personal, that's a little bit more appealing to an audience. Sometimes you can use emotion or stories to make a message more memorable to someone. Sometimes humor is appropriate. Most of the time you want to avoid scare tactics and fear messages. There's plenty of health communication theory out there that's evaluated the use of scare tactics and fear messages, and 99% of the time it's not an appropriate communication strategy. However, if you've done the appropriate research and evaluated it, and you do feel that a scare tactic or fear message is the best message for your campaign, you need to include a solution. You don't want to just scare them and leave them hanging. You provide a solution that provides the reader or listener with information on how they can move past that scare or that fear. Most importantly, if you are developing your own messages, they need to be pre-tested, which means you need to get audience feedback. That could be through a focus group, through a select series of interviews. You can also involve your partners in this, any partners who are familiar with your target audience or healthcare professionals. By pre-testing it and exposing this message to a small group of people, you're getting feedback from them that might tell you if language is offensive or neutral or even boring and just not interesting. And that can help you figure out if it's going to be an effective message or not. You don't want to skip the pre-testing phase, put thousands of dollars into a marketing campaign, only then to realize that that message was not effective for your audience. The pre-testing is a very important part of developing a new message. So we've developed the what, which is your message. Next is figuring out the how and the where. So how do you want to say it, through what media type, and where do you plan to say it? So this is where that audience description that you wrote comes in handy. If you think back to that audience description, what are their media habits? Do they learn or do they receive info mostly from magazines and newspapers? Or is it through their doctor? Some audiences might get their health information only from their doctor. And then what community locations can you find them? That's helpful if you're planning on doing any print ads, billboards, things like that, posters. And it's always important to consider if your what, the message that you're creating, fits with the how and the where. Some messages just don't work as a radio ad, and some messages just don't work as a print ad. So make sure all three of those are balanced and fit well together. Here's just a list of some of the major media types that are options for developing marketing campaigns. And the CDC has a very helpful sheet that goes through these media types and lists some of the advantages and the disadvantages of each. So that's a resource that I have a link to at the end of this presentation, and I would highly recommend using a tool like that when selecting your media types. As you're selecting your channels, so you know what your message is, you know how you'd like to share it, and you're trying to figure out where you're going to share it, what specific radio station, or if it's social media, where on social media are you posting your ad? You need to assess each of those media channels using these questions. So for that specific channel, what proportion of your audience can it reach? If you want to advertise via TV, and the TV channel says, we have a weekly viewership of 500,000, that's awesome. But if 495,000 of those are children, and your audience is elderly adults, you're not reaching a very high proportion of your audience. So keep that into consideration. Does it reach your audience at a good time? Is it going to be an ad that plays at a time when they're home and listening, or are they all going to be at work? Can the channel interact with or be personalized from them? Social media is a good example of that. And how well can the channel convey information at the level needed for your audience? Is it an appropriate level, whether it's literacy level, education level, things like that? Cost is always a factor. And then I mentioned this before, but can you get evaluation data or metrics from this channel? When you're planning your marketing plan, the evaluation needs to be at the back of your head from the beginning. You always need to ensure you have a way to evaluate it. So next we're going to move on to the budget. The budget is fairly simple. Everyone's familiar with budgets. As you're developing your marketing plan, you need a firm and a realistic marketing budget to accompany it. Let's say you're writing a proposal to management to put together a marketing plan, it's a good idea to put together a few of them, some of them low cost, some of them high cost, and present management with a variety to choose from. Now, if you're doing a variety of marketing plans, make sure you also include estimates on reach and exposure for each goal and list out the goals, or for each plan, and list out the SMART goals or SMART objectives for that plan. A low-cost marketing plan is cheaper, but you might not have as high of reach and exposure, and your SMART goals might be a little bit less enthusiastic because of that. For every marketing plan you put together, you do need a red light decision point. And this is a metric that tells you to stop if the marketing plan isn't generating sufficient ROI, or return on investment. So this is also why your metrics are important. You can't tell if your marketing plan is working if you don't have those metrics to track it. So come up with that decision point where you say, okay, if we have not achieved this amount of reach, or this amount of exposure, or this level of awareness by this point, it's the red light. We're going to stop and reevaluate and start something new. So next is the action plan. Once you have once you have a plan for your message, your materials, and your channels, now you need to actually decide how you're going to go through this process of promoting and distributing your marketing campaign. It's essentially a to-do list for your marketing product. So who is going to be involved in this process, and what are their responsibilities? If you are developing materials, let's say you're designing a poster, who is responsible for producing that poster? Are you doing it in-house? Are you hiring a graphic designer? If you're hiring consultants, contractors, or external people to work on this, who's responsible for setting up those contracts? Once you have your marketing materials developed, who is going to distribute them? Who is going to fill out the paperwork for the newspaper ad and submit it into them every 1 or 2 weeks, or at whatever frequency they require? Let's say you're doing flyers and disseminating flyers at the physician's offices in your area. Are you mailing them? If so, who's doing that? Are you driving around and dropping them off in person? Who's doing that, and at what frequency? And then you also need to set responsibilities for payments or agreements required for your marketing plan. And then most importantly, again, is evaluation. Who is responsible for tracking that? At what frequency will they be collecting evaluation data? What metrics are they tracking? This is really easily tracked in a spreadsheet where you include all of the metrics you're going to be tracking and at what frequency you'll be tracking them, and then you can fill it in as you go. Now, if you have multiple marketing materials you're disseminating via multiple channels in multiple ways, which remember is highly recommended because it makes your marketing campaign more efficient, you want a content calendar to keep track of it. It can get kind of complex when you're developing these complex marketing campaigns, and a content calendar makes sure that everything stays on track and you know what is being disseminated, where, at what time, and by who. So this is an example of one content calendar. This is one that could be developed on a tool like Google Calendar, Outlook Calendar. And in this calendar, they use the event to identify what it is that they're sharing, whether it's a webinar, an ebook, a video, a newsletter. The color coding also associates with that specific content type. And then they have the date to show what day it's supposed to go out. Social media can get very complex because most people are familiar with social media. A social media news stream or channel shows the most recent items first, or the most liked items first. Depends on the social media channel, or the most viewed. And so when you're posting on social media, you typically need to post more frequently in order for your campaign to be viewed. Content calendars are very helpful for social media. Here's another example of a different type of content calendar. This one could be done in Excel, or if you use a product like Smartsheets, things like that. In this one, they have at the top all of their distribution channels. So this is a social media specific one. They have Facebook, Twitter, email, LinkedIn, Pinterest, everything. And they're all color coded. Now on the left, for each of the row headings or each of the rows, they have the specific content type that they're sharing. And then in the columns, they have the dates. So they've identified here for each content what channel it is being distributed on, and on what date. And this is another really good way to track if your content is being shared the way you want it. It's a lot easier than having to read through an entire marketing plan and remember the frequency for each one. Laying it all out to begin with is definitely the most organized way to do that. So lastly is metrics. And I've talked about metrics and evaluation throughout this whole presentation, but here we're going to go into a little bit more detail about the various types of evaluations. So for each of your marketing plans that you develop, you need to have a process evaluation, which is short term. And this is an evaluation on if your marketing plan was implemented as you intended. You're evaluating yourself and the marketing plan development and implementation process. So as part of your marketing plan, right, you designated roles and responsibilities. Your short-term evaluation is going to look at, did those people complete those responsibilities, and did they complete them on time? Did your marketing materials get disseminated through the appropriate channels at the times they were supposed to? Next is your kind of medium-term evaluation, or an output evaluation. So this is where we're looking at those SMART objectives you developed for those marketing metrics. You developed objectives for reach, exposure, and/or awareness. Did you meet those? Did the data show you met them? Did you exceed them? Where did you maybe fall short? And then lastly is your longer term or impact evaluation. So this would be really, if you look at that overarching goal, did your marketing effect or your marketing campaign have an effect on target audience's awareness, their knowledge, their skills, beliefs, perceptions, behaviors, etc. Whatever it is you were trying to change, did your marketing campaign do that? And then on a very, very, very long-term scale, did health indicators of your priority population change? In public health, we're always trying to improve various health indicators. And of course, that's a lot longer scale than one marketing campaign. But over time, is your population's health improving? Now, your metrics can be qualitative or quantitative, depending on what works best for them. Really, the important thing is that each of your metrics is going to allow you to evaluate success based on your written SMART goals or your SMART objectives. So we've gone through the 7 components. I'm just going to review them now. We started out with the situational awareness or analysis process, and then identify the target audience. Once you've done that, you're going to develop your SMART objectives. And then you develop your marketing strategy. What's your message? How are you going to share it? Through what channels? And then you develop a budget, an action plan, so assigning roles and responsibilities and deadlines. And lastly, your metrics, your evaluation plan. Now, these 7 components together give you a comprehensive evaluation plan or a comprehensive marketing plan. And these 7 pieces need to be written out. A marketing plan is going to be most effective if it's written out ahead of time in full, all 7 components addressed prior to beginning your marketing process. Now, lastly, I just want to go through a few additional resources that could be helpful in your marketing process. So I mentioned social media marketing a few times throughout this presentation. Social media marketing is different than other kinds of marketing because of the complexities of how social media works. And there's also the additional factor that you can interact with your audience on social media. You don't just put the marketing campaign out there, but people might be able to comment on it, like it, share it. Things can go viral on social media. And so the CDC has developed a collection of tools, guidelines, and best practices for social media marketing and interaction. If you're going to be doing social media work, I highly recommend looking at some of those tools. Next is a few resources that are helpful for communicating. A lot of times in public health, we have jargon or public health lingo that we're all very familiar with and use in our day-to-day lives. But when communicating with our target population or the general public, it's not effective. So the CDC has a few tools. One would be the Clear Communication Index. And this is an evidence-based tool to help you evaluate your communication materials to see if you are communicating clearly. They have both a long form and a short form of this tool. It's like a little checklist or an evaluation you use. And that can be a good tool to use when you're at those final development stages to see if your product is communicating your message as clearly as possible. Next is the health literacy site on the CDC. This provides a lot of really good resources and training around health literacy. Different populations have different levels of health literacy, and recognizing those is an important step of that understanding your target audience process. There's also the CDC website that provides everyday words for public health communication. Now this one is focused a little bit more on action words related to like assessments and evaluation, things that might go in a report you're putting out about a project. And it's got a fun little tool in there where you type in a word and it spits out an everyday word or sentence that you could use in exchange. That tool doesn't have as many disease or condition specific words as the health literacy page does, but together they make a very good team of tools, I guess. And then lastly, for communicating clearly is a website usability testing page. If you're going to be using websites or online media in any form, usability is an important part of that. I'm sure everyone has been to a website that's been a breeze to navigate. You opened it up, you could see where you wanted to go immediately, navigated there, and it was simple and not frustrating. Everyone has also been to a website that looks like it was built in the late 90s and not updated a single time since then. Those websites have pretty poor usability, and you lose your audience because of it. And so this tool can help you figure out how to improve usability, not only to keep your audience engaged, but also to make your website accessible and usable for people who may have disabilities. And then lastly is a marketing toolkit. It's the CDC's DSMES marketing toolkit. A lot of the resources that I shared today from CDC came from that toolkit. And although they call it the DSMES marketing toolkit, it's not just for DSMES. You could use it for any evidence-based program. I think the only thing that is DSMES specific in it might be the examples or some of the websites they link to. Otherwise, this is a very handy tool. It's developed via online modules that you can work through. You can view only the modules you need assistance with or all of them, or you can print out the whole thing as a PDF. And this is a very helpful tool to walk you through the entire marketing process. So with that, those are all the tools I have to share today. I'd like to open it up to questions. We do have the chat box as an option for questions. There's also the Q&A box. And then lastly, you can ask questions via audio. If you'd like to raise your hand, you can do that. Or I'm going to set up a setting right now so that as participants, you should be able to unmute yourself. So we'll go ahead and give a few minutes here for questions. Oh, we have a raised hand. Okay. Trina, you've been unmuted if you'd like to ask your question.
Hello?
Hi, we can hear you.
Okay, yes, I guess my question is, recently we've tried to, at the Prince George's County Health Department, do a targeted, I guess, outreach strategy to physician offices. And, you know, we're finding some success, but that's challenging too. And I guess my question was really trying to find out some areas where people have been more successful or have found success with reaching out directly to physician offices.
So when you say you're reaching out directly to physician offices, is that to try and increase physician referrals to a program?
Yes.
Okay. And now, what kind of outreach has it been? Has it been one-on, in person? Has it been sharing of flyers and other informational materials?
Yes. Well, first calling and trying to, get an opportunity to go to the office and speak to the office manager, um, and then, the opportunity to kind of show them the flyers, inform them about the program, the marketing materials for the DPP or the CDS&P class, and then with the ultimate goal of getting an opportunity to come back at another time to speak directly with the physician.
Okay. So I have, I guess, a couple experiences I could share related to that. One of, I think, the common factors that we find with physicians is they are a very busy population. And so oftentimes getting that time with them is challenging. Quite a few programs have had success in, rather than targeting physicians directly while at their office or during the workday, they've been providing information through either webinars or presentations that are sponsored by or shared by either the hospital association or the medical association in their state, or at conferences that the physicians tended to visit. Because the physicians have already set aside time for those events, or it's a recurring, monthly webinar on their calendar, getting a foot in the door that way has been helpful. Otherwise, I would always recommend, just like in the audience, the target audience research part of this process, if you can get feedback from a few physicians in your area who might be partners to your program, ask them what is their preferred method of communication and what is, the most efficient way to communicate with them. And then following their lead on sharing of information and communication could get it might be applicable to additional physicians in the area and help you get a little bit more access to their time in their office.
Okay, thank you.
You're welcome. Let's see. If there's any other questions, you can raise a hand and I will be able to unmute you to speak, or you can type into the question and answer panel or into the chat box. Let's see. We have Trina. Did you have a follow-up question?
Well, yes, I had another question.
Okay.
We have tried a couple of different paid media marketing strategies, as far as on TV, on radio. We work with our communications department on the website. And I guess my question was, one of our goals is to try to figure out what we can do year round, some type of marketing strategy that year round we're continuously promoting the program and recruiting people, so we have a list. And then from that list, when we're scheduling programs, we can just pull from that list, other than it seems like whenever we're hosting a class that we are always kind of like starting from scratch with a new campaign. So I just wanted to know if anyone, had any feedback on, I guess, tips on how to do like a year-long campaign or things that promote continuous recruitment.
Yeah, so I've worked closely with a diabetes prevention program that has used that strategy. The benefit of a year-round campaign is you're increasing your reach and absolutely increasing your exposure, which is increasing awareness. And by doing so and increasing awareness, this DPP was able to get people on a wait list. And when it came time for them to start a new program, in addition to the benefit of having a list of people who were already interested, they were able to communicate with each of those people on that list and find a time that worked best for them for that program. So I hope that's helpful. I know we're at the end of our time here. There was one additional question in the chat box about short starting a program in a short time frame. How do you advertise for that? Again, that's going to be as high of reach as possible with frequent exposure. And that's following the community guide recommendation of using multiple media channels, multiple messages, and trying to reach as many people as possible in as many ways as possible. With that, I'm going to hand it over to Sue for a closing. I know we are at the end, but thank you all for attending today. I appreciate it.
Right, and I also wanted to thank Hannah for her very good presentation today. Thank you all for attending this webinar. Please join us for the next marketing webinar, part 2, on Wednesday, August 28th, same time at 12 p.m. Sorry to take up your lunchtime for that. And we'll have a part 3 coming up, and you'll stay tuned. We'll be sending out emails about when that is set up. So thank you all for attending, and so long.
Thank you.